Welcome to vlog number 39. Someone is sick with COVID. What to do? I am Dr. Mella. If you are new to this channel, welcome. Today's topic is actually pulled from the WHO infographic entitled What to Do if Someone is Sick in Your Household. Due to anxiety, due to fear, and believe it or not, due to embarrassment, a lot of COVID-19 patients and their relatives have done so many things wrong when they get a call from the local health department or the testing center informing them of their SARS-CoV-2 positive result. That is why we need to make people aware what they should do should it happen to their loved ones. That's why in this infographic it says life has to continue even where COVID-19 is spreading. The human race has lost in the battle to stop the pandemic from happening. We need to agree that we have to live with COVID-19 until global vaccination is successful. This is the new normal. So how do you stay safe? Number 1, isolate the sick person. COVID-19 symptoms vary. From my experience in the field, the symptomatology is predictable. 1 out of 4 or 25% of young patients aged 18 to 40 years old, which is the working class, do not experience symptoms. These are usually those who take care of themselves and drink multivitamins and supplements. 75% or 3 out of 4 experience mild symptoms. Fever is common, but not everybody has fever. Back in 2020, young COVID patients had fever reaching 40 degrees Celsius. Today, in 2021, most of these patients have a mild fever of 37.2 to 38 degrees Celsius. I can't explain it, but that is what I can see in the field. The cough is usually not productive. If they produce sputum, it's usually because they may have another concurrent bacterial pneumonia, which explains why antibiotics work. Or they may have an obstructive airway disease like asthma, or because they smoke heavy. A runny nose is uncommon. Those experiencing watery nasal discharges are also those with allergic rhinitis or a concurrent bacterial infection. But the anosmia or loss of smell is so sudden you can't explain it. It usually precedes a loss of taste or ageusia, but both anosmia and ageusia are also uncommon. For patients 40 to 60 years old, the symptomatology is also different. It is in this age group that we find diarrhea or watery stool. Pneumonia with this age group is severe. This is because after 40, we usually find concurrent degenerative comorbid diseases like diabetes and renal problems in that population that complicates the ability of a human being to fight off infection. Chest pain is usually pleuritic in origin. The patient complains of pain in a certain part of the chest when he coughs or breathes deeply. This is usually followed by difficulty of breathing. For patients 60 years old and above, the symptomatology is catastrophic. I'm starting to see heart attacks as the initial primary symptom. Sometimes it's the only symptom and we find out he or she is COVID positive post-mortem. I have patients who were reported to suffer a stroke or had acute renal failure. Those who survived the initial attack then have the symptoms of fever, difficulty breathing, and other symptoms that I have mentioned. It says in the infographic, prepare a separate room or isolated space. A vast majority of families in the world live in what resembles DIY modular homes. A small area of living space is usually divided by furniture, and that is what is home to 5 to 6 people in an extended family setting. If that is the case, prepare a space for a sick person that is near a window or near a second door of the house. If there is a separate room dedicated to the sick person in your household, the infographic goes on to say, and keep distance from others. If a member is already infected, there is a high likelihood that you could already be infected. Or you may not be, but some other family member may have it. Remember that due to your age group or immunity status, you may be asymptomatic. So practice social distancing at the first instant. Keep the rooms well ventilated and open windows frequently. As of this vlog, there is a general acceptance that COVID-19 can be airborne. The emphasis on the words can be. The reason is micro droplets carrying SARS-CoV-2 can float in the air for a long period of time. This happens in an enclosed setting, particularly in COVID long-term care facilities or hospitals where micro droplets can be produced. In your home, if you shut off ventilation to an area, that area can have a lot of concentration of SARS-CoV-2 droplets in the air that can spread to another area if a door is simply open. The idea of ventilation is to provide fresh exchanges of air and allow the droplets to fall to the ground. Even micro droplets will eventually fall due to gravity. The SARS-CoV-2 virus cannot survive without the droplet, unlike the influenza virus, and it's very fragile to sunlight. This is why I don't see a lot of clustering of cases in neighborhoods with COVID-19 positive patients. In areas of good ventilation, the SARS-CoV-2 virus behaves like a droplet infection. In areas of poor ventilation, like in hospitals or long-term care facilities, we see airborne-like transmission. Number 2, reduce contact with the virus. The infographic says, identify one household member to be the contact person who is not at high risk and has the fewest contacts with the people outside. If you are pregnant, if you are below 18 years old, if you have comorbidities like hypertension, diabetes, or kidney disease, if you are 60 years old and above, or if you are sick yourself, you may not be the person to care for a household member with COVID-19. Assign one that doesn't fit those criteria. Most of the time, it isn't possible. Then you seek help. Other relatives can do that for you. But if no one steps to the plate, which happens most of the time, call for help. The public healthcare system today handling the COVID-19 pandemic is ready to isolate the patient if the resources of the local government can allow it. Next, we have wear a medical mask in the same room as the sick person. I've written a blog post about the different types of masks, and I'll link it to the description box below. I wrote there that whenever you are handling a sick person, a medical grade mask is needed. Do you need expensive N95s? No. Those are for healthcare workers who may be exposed to sudden spurts of liquid that might be contagious. It's what we call colloquially as splash protection masks. That happens when we intubate a patient or when we operate on a patient. With mild symptoms, you can wear the recently very cheap medical or surgical grade face masks. For added protection, you can wear face shields, which is very common here in the Philippines. Use separate dishes, cups, eating utensils, and beddings from the sick person. This is because you would want to sanitize the stuff before cleaning it with soap and water. I use a diluted Lysol spray most of the time when I want to sanitize surfaces, but the general recommendation is a diluted chlorine solution where you can soak the items. Just make sure you rinse them thoroughly with soap and water and dry them before reuse. Chlorine is a poison and Lysol is carcinogenic. Sometimes the best is the use of disposable cups, dishes, and utensils, but even that is costly to the average family. Clean and disinfect frequently touched surfaces. Ethyl alcohol is the most used and is effective if the grade is more than 60%. I use diluted Lysol in a spray because that is how I was taught in fire school in Virginia Beach. It takes a longer time to dry surfaces, and during that time a lot of infections, not just COVID-19, will die off when somebody coughs at it or touches that surface. Number 3, take care of the sick person. A viewer might say to me, "Of course I'll take care of the sick person, that's my mom." But you'd be surprised to find out that a lot of those relatives I got to talk with that had COVID-19 positive household member in the house treat this like a zombie infection. They're always asking me to remove the family member immediately, even if it's their mom. It's sad, but it's the reality I face every day handling this disease in the community. The infographic says monitor the sick person's symptoms regularly. With a mask on, you can adequately take care of a household member with COVID-19. You can talk to him or her and ask him how he or she feels. Just practice social distancing and keep the house well ventilated. Pay special attention if the person is at high risk for serious illness. Remember, 60 years old and above and those with comorbidities can experience COVID in a different way. COVID can hit your household member really fast and you would want to react quickly to get the urgent help needed. Ensure the sick person rests and stay well hydrated. Resting recharges the immune system. It actually recharges the entire human body and we call that recovery. I can't explain it here, it's very lengthy. Also, another fact is that well hydrated means that you have enough exchanges of water that your pee is clear. Why is that important? Again, it's a very lengthy topic and something that is overlooked today. It has something to do with what we call homeostasis. How your body needs water to maintain it and how water is used by the body during recovery. The last part is call your healthcare provider immediately if you see danger signs. An important danger sign here is difficulty breathing. This is profound in COVID-19. Ask them to stand and walk a few paces and they are already struggling for breath. Even sitting up or lifting an object makes them hard of breathing. The next one is loss of speech or mobility. When they collapse and looks barely conscious, it's usually because their oxygen levels are so low all of a sudden. When they are lying in the ground, they usually feel slightly better because their heart is in level with the lungs. They are usually confused or talk partially because not enough oxygen enters the brain. This happens most of the time very suddenly. Chest pain. It can mimic that of a heart attack. But the chest pain I encounter in the field most of the time is that of a feeling of sharp needles on their sides that worsen with inhalation. All of these signs signify the severe or critical criteria and the patient needs to be admitted in a COVID-19 designated hospital. A danger sign that is not added is no intake of food or water. This is something I would like to add as a physician to this WHO guidelines, but for a good reason it's not here. Currently, we are still experiencing surges everywhere in the world, and hospitals cannot care for all COVID patients. This is why the WHO does not place it here as a danger sign to be able to lessen that surge capacity in hospitals. But it should be. It's a subtle danger sign and very important. Particularly in the elderly, patients are so sick or confused that they refuse food and water. This increases the risk of them dying from a cardiac arrhythmia. I interview relatives who show up for me to sign the death certificates of those who were suspected to die of COVID-19 in the household. There was a recurring theme in the history. They just refused all oral intake and within the day they were found dead on the house. All of these signs require that you call for help. Call 911. It's 2021 and the public health and emergency medical systems have adapted greatly to respond to COVID-19 emergencies. Your patient has the best chance of survival if the emergency medical system is activated, rather than rushing your patient to the hospital. And that's it for this vlog. The infographic answered the message, know your risk, lower your risk. Remember, it's always safer to practice social distancing, wash your hands, practice good cough etiquette, wear a mask, and keep your house well ventilated. This is Zero Mella MD, physician, firefighter, EMTB, and your friendly neighborhood vlogger. Till next time, peace out.